The perspectives expressed in this podcast are those of the host and guests. The views expressed are their own and do not necessarily represent the views of the National Institute of Health or the United States government.
Hey, Sickle family. I'm Wumi Bakare.
And I'm Dima Hendricks. And we would like to welcome you to the Through the Genes podcast,
where we talk about living, healing, recovering, and exploring curative therapies for sickle cell disease.
We will also talk about our individual curative therapy journeys and the bond that we built as sickle cell sisters.
Welcome back to Through the Genes. On the last episode of Through the Genes, we were joined by Dr. Staci Martin, who introduced acceptance and commitment therapy, also known as ACT. In this bonus episode, she will put ACT into practice. Take a look.
But there's no way we're going to have you on this podcast and not delve into acceptance and commitment therapy, because you are the queen of things act. So I know what acceptance and commitment therapy is firsthand, because I have tasked myself with practicing it over the past 3 years. I'm proud to say now that I can show off my skills, but we'll just say that for a different show. But Dr. Martin, please walk us through ACT, and can you give advice as far as how people can really transform their way of seeing their life and the things, the circumstances that are happening in their life?
Yeah, sure. Oh, I'm so glad you asked that question. ACT is one of my favorite things to talk about. And it's a model of therapy that has 6 core constructs. And they are mindfulness or present moment awareness, acceptance, diffusion, which is kind of stepping back from our thoughts, not letting the thoughts control us too rigidly. Something called self as context, which is basically perspective taking and kind of not letting your rigid identity prevent you from living your best life. And then there's values, which we've talked about, and committed action, which is committing to engage in values-based actions. And they all work together to help increase our psychological flexibility. So that's the core of ACT, this thing called psychological flexibility, which is, can we be adaptive when the situation calls for it? Can we be flexible enough to engage in behaviors that bring us closer to the life we want to live, even when it's uncomfortable? If we are inflexible and rigid in our thoughts and emotions and actions, then we miss out on a lot. And we talk and act sometimes about everything we do moves us towards or away from a value. And even the things that we don't really think about, right? Like we brush our teeth every day because I brush my teeth every day because I care about my dental hygiene, I don't think about it every time I brush my teeth, right? But if we think about, why did you show up today to do this podcast? I mean, Wumi, you had to get up really early to do this podcast. That probably wasn't fun when your alarm went off. Why did you show up, right? Because there's something that you care about in that, in being here and doing this work for the community. And Dima, I'm guessing the same is true for you. You showed up because you care about this work and this journey. And so sometimes if we're being inflexible, we lose sight of those values. We say, oh, nope, I got to get my 8 hours of sleep. I'm rigidly adhering to that rule. So I'm not going to get up that early and show up for this podcast, right? But being flexible allows us to experience things that aren't always comfortable, being willing to go through some uncomfortable feelings and situations in the service of what you care about. So I think in a nutshell, ACT is just being tuned in to the present moment and what shows up, willing to experience it all in the service of the things that we care about.
That is so good. I feel like I'm going to be jumping all over the place with this question, but it's something that kind of brewed in my spirit as you were reflecting on ACT. And so there is a rigidness that happens. Yes, I feel like staying in bed. I'm not, I'm choosing not to be active in the world, but I think, um, for individuals like myself and Wumi, there's also a rigidness when we encounter a brick wall. And for instance, um, when I'm experiencing sometimes, um, see, like right now, brain fog, or if I have an infarct in the middle of a sentence, or like trying to gather my words, or knowing the words on the tip of my tongue, and there's like a rigidness of like, I want to make this perfect. What I'm asking is supposed to be perfect. What I'm doing is supposed to be perfect. Or like even in a board meeting, and all of a sudden everything that you wanted to present, everything that you wanted to say completely
Yeah.
exits your brain.
Yeah.
It's something that I experience as a warrior constantly, and it's absolutely frustrating.
Yeah.
What do you say
Yeah.
to the individuals or the warriors who are aging like myself, who are experiencing these newfound wonderful symptoms and trying to navigate through it?
Well, so we'll take your example, Dima. And so if I were your ACT therapist, I might ask you, okay, so you have this thought that it has to be perfect. You have to say the perfect thing. How tightly are you holding on to that thought? So let me ask you that.
For dear life.
Really tightly, yeah?
Yes.
For dear life. Okay. And so then I might ask, is holding on to that thought tightly helpful to you? Is it helping you live the life you want to live? Does it get in the way?
It gets in the way.
It gets in the way. So I might ask,
It
what would it,
develops it develops into an imposter syndrome.
yeah, okay. So that's good noticing there, right?
Yeah.
That's really good noticing. And so then I might go through, what would it be like to loosen your grip on that thought a little bit? Just a little bit. What does that feel like? Is it bringing up anxiety, or is it yeah, yeah,
Anxiety.
yeah,
Won't be able to perform.
yeah, yeah.
Yeah.
So then we might just kind of explore that, where's the anxiety coming from? Um, and I wouldn't try to get you to get rid of the anxiety, because that goes counterintuitive to acceptance, right? But from an ACT perspective, I would say, yeah, you're human, you're going to feel anxiety, and it makes sense because there's a value underneath that. When we're feeling anxious or sad or angry, there's usually a value under that. And so, what would the value be for you to have it be perfect? Why? Why do you want that?
I think it's cultural. I think it's, you know, maybe because my mom's Jamaican and my dad's Nigerian.
Yeah.
There's a culture, both sides of the coin are like, you have to be perfect.
Yeah.
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 You should be a doctor. Why aren't you a lawyer? You have your master's degree. Why don't you have your doctorate? It's those expectations
Yeah.
that are always looming. Oh, you have sick. That is not a sickle cell is no excuse. You
Uh,
know,
yeah.
there's a little of that's plaguing in my brain right
I mean,
now.
I'm glad you brought up the cultural aspect, because that's
Mhm.
something that shouldn't be ignored, right?
Yeah.
And also, I would venture to guess that you care deeply about um, the work that you do.
Yes.
You care about this podcast. Guess what? If you didn't care about the podcast, you wouldn't care if you said the right thing,
Right.
right? And so that's the alternative. And do you want that alternative, right? So, but I would suggest that when you notice that you're holding on to a thought really tightly, to see what happens if you loosen your grip on it just a little, and to see if you can get to a point where that thought isn't controlling you and leading you to a life that you don't want to live.
Mm.
Right? So maybe give it some thought, like, how do you want to show up when those thoughts, when you feel that thought taking hold, right? When you're holding on for dear life, how do you want to show up? Do you want to let that thought control you? Or do you want to dig into why it's important to you and let that value be your guide instead? Does that make sense?
You're good. Yeah, we need to talk after this. But that was good. On the next episode of Through the Genes, we are honored to have our very special guest, Kara Demeen. Kara is not only a genetic counselor, but she's also the host and executive producer of the award-winning podcast DNA Today. Join us as we dive into her insights on genetics and her journey in raising awareness through her impactful platform. Don't miss it.
Through the Genes is funded by the National Human Genome Research Institute, part of the National Institutes of Health, through the Democratizing Education for Sickle Cell Disease Gene Therapy Project. Don't forget to follow Sickle Cell Prodigy and Through the Pain Inc. for additional resources and initiative updates. Thank you for tuning in to this episode of Through the Genes.